I'm going to discuss with you how to fit a crown. Basically, this is a metal crown, which is made under the NHS. So we've done a chamfer prep for it all the way around. The tooth has been root treated. It's got a post in it and a core, and it's got a chamfer margin all the way around it. We asked the technician for a metal crown, which is like this, and also the internal fit of the crown has been sandblasted to increase your resistance when you're cementing it. Now, unfortunately, with NHS labs, they only tend to send you one of these. If you want to request study models, which you should, you have to write it in your lab sheet to request it. So all these impressions were sent, beautiful impressions, all in silicone, because it's dimensionally stable, and we did write in the lab sheet to give us models, full arch models, but they haven't, and they've just given us this little thing. So with this, you can't check the occlusion. You can't really check a good marginal fit with it either, because you need to have your die cut to be able to see your marginal fit. However, you can have a little vague idea of what's going on. So it's not the best, but anyway, we've got to do what we have to do. The patient's waiting and we need to fit the crown. So I would suggest try and check everything before your patient comes. Open everything, check your crown, make sure that it's been sandblasted, make sure it's reasonably good fit. Now, the things which I tend to use before is shim stock. So shim stock is this thin foil, and it's 8 microns thick. This is to check the ICP in your patient. Because it's 8 microns thick, it won't cause any interferences in your bite when you're checking ICP. Also, the articulating paper is very thin. Again, this is 8 microns thick as well. Okay, so what you do is you, before you put the crown, after you've taken the temporary crown off, take the temporary crown off, pumice your prep, make sure your prep's nice and clean. If the patient's sensitive, you can give a bit of local anesthetic to your patient. My patient is not, because my patient has had root treatment and a post, so won't feel any sensitivity. Take your Miller's forceps, put your shim stock in it, and then you can, I will show you on myself. So you put it between your teeth, between the patient's teeth, and get them to bite. So like this. And see if you can check the contact point. So choose 2 teeth, normally premolars are the best if they're present, and check the contact point and make sure that it holds well. Okay, so once you've done that, take your crown and try it in the patient's tooth. Obviously, pumice your prep. Try it and then get your shim stock and check your 2 contact points with the shim stock, and make sure it holds the same way as it did without the crown in. So if it did, then you know that the crown in ICP is correct. Okay, after you've done that, you can check the guidances, and then you can check that with the articulating paper, and you can put that between the teeth and get the patient to go left and right. Obviously, I'm sure you have checked the guidances before, so you know if the patient is canine guided or group function, and also depending on the tooth you're prepping, you can always try and keep the tooth out of guidances if the tooth is weak. So in this case, my patient is canine guided, so I know that my patient is not going to be guiding too much on my crown. So what you do is you find out if there's any interferences outside the mouth. You can adjust your crown. Sort of with a metal, you can use a diamond burr to adjust the crown a bit, to see if there's any interferences in guidance, or even in ICP if you noticed any interferences. And then you polish it, and then you put it, and then you can then put in the patient's mouth. Show the patient. It's very important to show your patient what type of crown they're getting, because they might turn around and say, I don't like it, or I don't like the shade, or I don't like this, I don't like metal. Obviously, you've discussed all this before, but patients can always change their mind. So then you show it to the patient with a mirror, make sure the patient is happy, say that you are technically happy with it and clinically happy. it's got good margins, it holds well in your bite and in your guidances. Say you are happy, but ask the patient if they're happy. If the patient is not happy, do not cement it, because it's going to cause problems. But if the patient is happy, pumice your prep again, clean the inside of your crown, make sure it's nice and dry. And then for metal crowns, you could use a GIC based cement to cement it on, and that way, then after that, you clean all the excess cement, you floss all the margins, make sure there's no cement stuck in the margins, and then you then again use your shim stock to check the ICP, use your articulating paper to check the guidances, and make sure you're quite happy. When you're cementing, make sure that you hold the crown really firmly on your prep, just to make sure that it's seating. Get your probe and go all the way around the margins and really check all your margins of your prep to make sure that the crown's really seated well, because there is sometimes this can happen that you may not push firmly, and you'll find that the crown's sitting proud of your prep, and then the bite will be high. Hope this helped. Thank you for watching.